Okay. Hello, everyone. Welcome to this webinar. There's a lot of material to cover. I'm not going to go over everything. I'm going to just highlight some points, and I will make this text available. And also, I already made 4 other documents that are related to this presentation already. They're available. That you should have already received them. Okay, so why should we have another conference on COVID-19 if we already had one in? Oh, I see. You don't have my camera. Okay, why should we have another conference on COVID-19 if we already had one 3 months ago in October? Well, this time was to give an overview, not only from one person perspective, but from the profession as a whole. So I asked my colleagues to write me their experience, and also specifically, even more so, with the advance of the Omicron variant, it changed the ballgame. So we're going to go over that. And why did I change the date from the 7th to the 21st of January? Because I was waiting for the data that came out of the Liga colloquium that was held in December to become available, and it was supposed to be available mid to like the 3rd week of December, and then the end of December, and then the 1st week of January, and now we're the 19th of January. Or the 21st of January, and it's not yet available. So we may just as well go on with this webinar. And unfortunately, I will not be able to use the large data that was presented at the colloquium, which everybody will have access to it, but nobody. I will not be able to do a summary because it's too late now to do a summary of what was presented at the colloquium. There was a number of papers that was presented on COVID. So be aware that this conference is recorded and it will be available today. It will be put on YouTube and it will be accessible from homeopathy.ca. So if you don't you don't have time to attend the whole conference, or if you want to share it with somebody else, it will be available to listen to it. Listen, COVID-19 is a huge disease. The human race is not familiar with the coronavirus, so it's creating a lot of morbidity and mortality. So it manifests itself in many different levels of severity, from being very mild in children, just a little sniffle or asymptomatic in many, to very serious complication, blood clots and respiratory distress, and eventually threatening life. Many, even people that didn't have life-threatening condition, would often said they've never been so sick in their life because it took all the energy out. They were bedridden with little capacity to do anything. So it's a very unusual type of condition for humanity. This presentation was prepared by clinicians that were on the field around the world. So I have some output from people from India. I have some from Europe, and the Americas. So it's from all over the place, and it's made for. It was prepared for clinicians in order to be able to practice effectively in this pandemic. So I want to thank all my colleagues that have helped me to get the data, send me some data, and that I included in this presentation. Unfortunately, I was not able to integrate all the data and information that people sent me. I used the one that was more pertinent. This presentation is somewhat like is meant to be like a testimony for future generation of homeopaths, to show what we have done so far, And it's a reminder of William Dewey after the Spanish flu in 1921. He printed an article which recounted the experience of 50 practitioners. It was called Homeopathy and Influenza, a chorus of 50 in harmony. So it shows that 50 practitioners that were shared their experience with during the Spanish flu. And similarly here, people have all the similar experience. And that's what one of the purpose of this conference is to gather interesting observation from many people that could be useful for others. I will present a broader overview of the epidemic, which will enhance everybody's learning. We can learn from each other, and so sometimes rare and unusual observation could be very useful for the general community. So I will report those too, and so it would be also interesting to look at different protocols and see the outcome. So essentially, there's 2 points I will address, but I will talk about prevention and treatment. So prevention of COVID-19 and the treatment of the patient with COVID-19. But we're going to talk about the long hauler. We're going to talk about the conventional vaccination. So there will be other thing. We're going to talk about Materia Medica, of course. Okay, very good. So let's start with the prevention. So the prevention here is essentially from the beginning of the pandemic. And from the beginning of the pandemic, we had the Wuhan strain, which was followed by the Alpha, Delta, and now the Omicron variant phase of the epidemic. So for the first 3 phases, the Wuhan, the Alpha, and the Delta, which were the main phase, we use the same approach in immunoprophylaxis, the same remedy, I would say. But with the Omicron, it's another ballgame, and I'll present that a bit later. So right now, I'm going to concentrate up to Omicron. So up to Omicron, despite the many different geographical area and the different variant, Wuhan, Alpha, Delta, Brownia was overall the main prescribed remedy. In my practice, it was 65 to 70%, but some people say up to 95% of their practice was Brownia. And for this reason, Brownia was almost exclusively used for prevention from March 20 until the Omicron phase by many physicians. So Brownia was chosen early in the pandemic because first I had 3 or 4 cases of patients presenting severe flu-like symptoms in December 19, so before the supposedly advent of the COVID-19 in Europe or North America. People were having very severe flu-like symptoms, and they respond. 4 of them, or 3 or 4, respond to Brownia. So it was compatible with the upcoming new case. And the more the epidemic progressed, the more Brownia was confirmed, and the more successful we were by using Brownia, with the exception of there was 1 cluster of cases that I was aware of in Northeast United States, where there were about 8 cases that require Ipecac. So in that little cluster, I used Ipecac for prevention for about a month or 2, but nobody got COVID in the one that you use Ipecac, but it was no proof of its efficacy because we don't know what would have happened if they had not taken it. An interesting observation that was reported by Betsy Bevan, who's from Massachusetts, prior to the Omicron phase, he says, I found Brownia helpful in over 85 to 90% of the case I dealt with all year. Maybe 10% needed another remedy. So she was much higher than us, but now different population, different experience also. Not all colleagues abide to the same posology for prevention, but here's how I did it, and I recommend it, except for hypersensitive people. So that's very important to understand that hypersensitive people is a different group. How to take Brownia? I would ask them to take Brownia 200 once a week to every 6 weeks, depending of the degree of exposure. The more somebody was exposed, like somebody like a healthcare worker in contact with patient with COVID, they would take it once a week. I had some many physicians, veterinary physicians, they would take it once a week because they were in contact daily with multiple people, some with COVID. So they would take it that way. Otherwise, some people that really would go out, it would be every 6 weeks. Like hypersensitive person would take like a 6C every 6 weeks or so, or if there was an exposure. And they would use the 200 for 6 to 12 months, depending of the number of doses that they had taken in. And after 6 to 12 months, they would switch to the 1M, which they would take in a similar manner for another 12 months, so for another year. After the 1M potency, some moved to the 10M, and but here the frequency was less, 4 to 6 weeks. And if somebody had a clear exposure to somebody that is coughing, or somebody was just diagnosed with COVID, then they were asked to take the remedy twice a day for 2 or 3 days. However, if it was too late, before that, here it says, and for the people that were flying, taking airplanes, going to airports, taking trains, or meeting large group of people, especially in close space, they were recommended to take extra dose of the remedy at that time, before and after, especially if there was a lot of cases. Like now, there's a lot of cases, so people that are traveling, I would suggest they take the remedy before and after each flight. And for the hypersensitive people, like I mentioned before, they would take a lower potency. So, for instance, I have one that is extremely sensitive. She takes a 6C, very, very diluted, and she uses a toothpick, and she takes it once her husband was exposed and so on, but she never developed COVID. So if somebody is too late, they're already starting to experience flu-like symptoms. There's a number of people that took Brownia, but very occasionally, and sometimes they won't take it for 3 months or 4 months. In any case, even the people that took it regularly may not have changed the potency as they should have. In any case, some people did fall sick and they start to feel flu-like symptoms like sore throat, chills, fever, body aches, fatigue, and so on. So at that time, here it says, yeah, none to my knowledge though have a serious fall sick, so that's important. So nobody that to my knowledge that took Brownia for prevent fell sick, seriously sick. There's none. So again, so if it was too late, they were asked to take the remedy every hour for 3 doses. As soon as they would feel the symptom of the flu-like symptom, and if those symptoms would relapse, let's say 6 hours later, and the symptom would start to relapse, then they were asked to take again the Brownia every hour for 3 doses. And if they would develop a full case of COVID, they were asked to take maybe the next potency and take it every 20 minutes and so on, and to call us as soon as possible. Yeah, here I say, yeah, so the people that took it irregularly were more likely to fall sick, but nobody really got very sick. So to some degree, I say here that for most people, it's okay to fall sick. I explained this in a document that I sent you. It's called the epilogue. At the end, I say fever is finally our friend, because you have to remember that William Osler in 1896, in a presentation before the American Medical Association, said humanity has the three main enemies of humanity were war, famine, and fever, and the worst of the three was fever. And at the end of the epilogue, I say, no, fever is actually our friend, because we develop our immunity with an infectious condition, with fever. It has a purpose in nature, and on the long term, to protect against chronic disease, to develop immunity. For children, pediatricians have noticed for a long time prior to the era of vaccination, like the pediatrician that practiced in the 40s, 60s, 70s, noticed that before there was like a huge number of vaccination, that children, when they would get the measles or chickenpox or rubella or whooping cough, they would have a growth spur, both in terms of maturity and also in physical growth spur. So there was like a beneficial aspect of it. So, but there's also people that could be very sick with infectious disease, and that's why we have a position that is very unique, because we can offer a way to prevent serious disease and treat people with those conditions where nobody should die. Nobody should die from those infectious disease. So far, the use of brownia for prevention has met our expectation, and it has corresponded to the first stage of the disease in many cases. So the degree of effectiveness of brownia in the up to the Omicron phase of the epidemic met our expectation, and that are comparable to the one obtained with belladonna in the prevention of cholera fever. So I did a study, which I give you a summary of. It's in over 800 people who were similarly exposed to scarlet fever. Only 1% of the ones who took belladonna preventively contracted disease, while 60% of the ones who were similarly exposed didn't take belladonna, fell sick. So this is a great difference. And we could say that our expectation with brownia were met very similar to the outcome were very similar. You'll see, I'll give you a little chart a bit below. Yeah, so this summary, you are already sent it to you. Yeah, despite the best prevention, people will always will fall sick to epidemic. In history of homeopathy, if it was cholera, people did fall sick even taking the remedy. But the morbidity was not as serious, and the mortality was very minimal. And it's our experience with the current pandemic. So people that are treated with homeopathy, especially in the early stage, as long as they have access to the remedy. So this is very important, because if somebody phones on Friday evening with they say they fell sick to flu-like symptom, and we take their case and say, okay, you need this remedy. Where, if they don't have the remedy, and they order it, and the supplies are low everywhere, they're low, and they cannot find it until, let's say, the following Wednesday. So that's 5 days of being sick with COVID. It's not good. So we especially with the changing of variant and the changing of genus epidemicus. So for this reason, we asked our patient in November about to have a kit that will have the following remedy that would be useful probably for different upcoming variant, and also upcoming influenza epidemic, which epidemiologists had predicted will be serious either this year or next year. Will be serious. It will be 2 years in a row without influenza, and they think that when that happens, then it's more virulent the following time. So in any case, in this kit of remedy, they would have all the remedy they need to deal, not all the remedy, like maybe 95% of the remedy that would be indicated for flu-like symptom condition. Yeah, so another advantage of homeoprophylaxis, aside from the prevention, because not every time you will have a remedy that will be 100% the genus epidemicus, and always will prevent 100% of infection. You may diminish severity. So the main thing is you can decrease severity and certainly mortality by doing homeoprophylaxis. So here below, I collect all the experience of colleagues that wrote me with cases with people who took brownia preventively. some that were clearly exposed to somebody with COVID. And of these, how many were spare of the disease? How many over all of these who took Biotina were spare of COVID? And how many got COVID? How many of the disease was severe? And how many number of deaths? So if we look at so these are the people that reported, and everyone has little footnote to say, to present a bit the information. So if we look at the total, we have close to 2,000 patients that took the remedy. 113 fell sick, so it's about 6.4% rate of infection. However, 42 people that were exposed to COVID did not get a COVID. That's even better, more interesting, because here we don't know how many of the 113 took it regularly. There was only 10 severe cases, and again, of these 10 severe cases, how many took it regularly, we don't know, and there was no death reported among the population. We have one person, I think it's Lisa Marin, she reported a case. Oh, I didn't put it, oh yeah, it's here, you see. Let's see, she says she had one patient that died of a heart condition, but not related to COVID, so we cannot say that it was due to COVID, if I recall well. Yeah. Yeah, so 42 out of 40. I think there's more than that, because I had 3 more telling me this week, but it was not with Biotina, it was with another remedy, with Carbonium, that they had contact with patient with COVID and they didn't have any symptom. While the one that took didn't take the preventative remedy fell sick. So some people were caring for people with COVID 24/7. They slept in the same bed, because sometimes it was the spouse or a child, and which suggests a great effectiveness. So it's just suggesting. In the belladonna study, because there was 800 with the same exposure, and some took and didn't take, this is more than just suggestive, is a proof of efficacy. Yeah, so here, like, wasn't this one anecdote, but it's very typical of homeoprophylaxis. Here we have a person, she's in the mid-60s, she's a bit overweight, she's taking Biotina regularly since the beginning of the pandemic, while her husband and brother, who live in the same house, don't care for it, don't want to take it. The brother falls sick, he's diagnosed with COVID, her husband eventually falls sick with COVID. She asked her husband to take the Biotina because he's very sick, he's bedridden, and he accepted, because he felt he was dying from such a profound state of weakness and great difficulty breathing. And he began to recover right after taking the Biotina, and her brother, so when he saw that his brother-in-law started to recover, he decided to take it. So that's very interesting. She took care of both. She never fell sick, and the two did not take Biotina preventatively, recover with Biotina. And the husband insists to talk to me. He called me and says, "Thank you, because you have saved my Biotina has saved my life." So here is a good example of homeoprophylaxis, and that's typical. So other people have report similar experience, and I'll let you look over that. Here again, a colleague from Edmonton, Canada, report similar experience of people taking the remedy and being exposed and not developing the condition. Which again I say that it's typical. We have a let me see. yeah, we have a patient in Cincinnati. He notified 200 relatives, friends, and patients to take brownia. Of 125 of these, of those accept to take brownia on a regular basis. And as far as he knows, none of the people that he informed that took brownia got the infection, developed the infection up to the time of this. But it was interesting because there was one family, there were some that did not want to take the brownia. They got infected, and one of them died. It was a Supreme Court justice and alternate justice, and he passed away. And he refused to take the brownia preventatively. And we don't know how many people got. We know that we started the prevention in March 2020, and many people started in April 2020. So until the advent of the vaccine in December, so during that period, we were not aware of anybody that who had not had the vaccine for sure got sick with or seriously sick with brownia. So other interesting observation. Here's an interesting one, again reported by Betsy Bevan from Massachusetts, says, regarding the use of a nozzle for prevention. For what it is worth, I did have one patient who was 98 years old, who said she felt sicker than she ever felt in her life when she contacted me. She was taking COVID-19 nozzle for many months, so through work with another homeopath, but got the virus. I advised her to take brownia 10 ml every 2 hours, and in 48 hours she felt completely better. So here, sometimes people will rely on the nozzle. It could be very effective, but in this case, maybe she didn't change the potency. It was not very effective. Here is my son Joseph reports that people that took brownia that got a bit sick tested negative for COVID-19, even while the other ones that were more sick tested positive for COVID-19. You wonder if it was an observation. I could not report that. So there will be more interesting case that I'll let you read about it. So overall, the experience has been very favorable. You would say it's a small sample, and this is from a collection of busy clinicians that don't keep good tabs. But that's typical of homeoprophylaxis. That's typical of busy clinician in the middle of a pandemic. It's typical. We're not public health physician taking tabs doing a study. We're trying to save our patients. So in the imperfectiveness of using homeoprophylaxis on a clinical basis, it's as the use of homeoprophylaxis in this epidemic has met our expectation. So, which is an experience that we have had for over 2 centuries now, of the use of medicine to prevent disease. Hahnemann began in 1799, 222 years ago, with that's when it was discovered. The phenomenon was discovered. So the entire history of homeoprophylaxis is, as it has already been partially researched in an upcoming book, The Weight of Evidence. So we could say we have this very similar success as in previous epidemic. What I mentioned here, very similar to the research I just complete on belladonna, which is a scientific proof of the efficacy and effectiveness of belladonna to prevent scarlet fever. It's irrefutable. It's clear. It's obvious. It's a book that is will be sent to publisher as soon as finished to be edited. There was a randomized controlled trial where they used different remedies, and brownia was found better than placebo to prevent infection. But it was for the short term and so on. So here you have a double blind study. But even better is the trial report by Dr. Kumar Gupta of Agra, who administered, with the help of 20 non-governmental organizations, 2 doses of Brownia to 70,000 people for about 3 months. June, July, no, 8 weeks, sorry, about 8 weeks. Out of 69 weeks, it says here. But it's more like 8 weeks. It should be 8 weeks. So out of 60,000 people who got the Brownia, none became infected after the first 8 weeks. So, but here we don't have a comparative group. So again, it's just suggestive of effectiveness. The bottom line is that only prophylaxis is very safe. It's efficacious with the better protocol. It's cost effective, it's quick to deploy, and simple to apply. So it's quick to deploy. If we have a change of genus epidemicus, we can change the remedy like we did with the Omicron. Okay, regarding treatment. Before seeing my first case of COVID, I was very confident that we would be very successful. Even though we heard a lot of mortality from China, the first case, the people would die. I think they had a 50% death rate in the early part of the epidemic that was coming out of China, because I show in the weight of evidence that people don't die much of pneumonia under homeopathy. Here you have the homeopathy without being specified if it's like Hahnemannian homeopathy or any form of homeopathy. And here is Hahnemannian homeopathy, and this is pre-antibiotic allopathy, and this is current conventional care. So, and that was current conventional care was probably before the advent of all the ventilators and so on. So there was the last meta-analysis was 1996. So that was in the mid of the era of antibiotic. So here, just with before the advent of antibiotic, in allopathy they were reporting about anywhere between 20 and 30% death rate. My study came to 24. Osler did one, it was 30. Many studies came at 30% death rate. But with homeopathy, it was down to 3.4. And with Hahnemannian homeopathy, with about 2,000 cases, 0.6% died, so 0.3%. So that's why I always say that it's hard to believe that somebody can die of pneumonia with a good physician at the bedside. In October 2018, like 1 year before the pandemic, or a year and a half before the pandemic, or 15 months, I present 4 cases of pneumonia in elderly moribund patients before the American Institute of Homeopathy. That is a case of a 92-year-old and a 95-year-old with congestive heart failure. So these people should not make it. They have pneumonia. 99 years old that was in a comatose state, and the family would just say, let's just wait for death now. And finally, there was a case in a 100-year-old woman that had aspiration pneumonia and who also death was imminent. And all 4 cases recovered surely and progressively as soon as homeopathic treatment began. As soon as homeopathic treatment began, they start to recover, and they recover progressively. So if these people recover, anyone should be able to recover, and this with pneumonia essentially. And earlier over the years, I had showed that people with very serious case of pneumonia, like this one with pneumocystic carinae pneumonia with immune deficiency in a comatose person with cryptococcal meningitis, or patient with advanced lung cancer and pneumonia, or patient with kidney and heart failure with pneumonia, or people with supposedly incurable case of aspergillosis, and etc. They all recover under homeopathic treatment, gently, easily, surely. Finally, in 2013, I had a debate with skeptic Stephen Novella from Yale University, and he asked me what's the single condition that homeopathy has success with, and my answer was pneumonia. And my report to him was 450 page, but I mentioned among the 450 page that Royal A's had lost 2 cases among 900 cases of pneumonia, which 69 had malignant type of pneumonia. So we should therefore expect the same type of success in the treatment of severe COVID patient, and this has now been clearly confirmed, even in the most severe case with the most severe, with the worst comorbidity. And I have a number of cases here which I will present from my practice and from our also colleagues' practice. Yeah, so homeopathy has shown to dramatically help COVID-19 patients to a quick and steady return to health, regardless of their state of acute sickness at the onset of homeopathic treatment. I already reported in the early presentation in October, in June 2020, the work in a nursing home in France. And I recently reported the 2 cases that were presented before the American Institute, a very severe case of COVID in October. So here, without doing the case, here's the COVID case in a diabetic, slightly overweight person. And the person was essentially non-functional by the time his business partner came to see him. And the case is described. I presented in October, and what's interesting since that time, what's interesting is he became sick in mid-August. The treatment was started September 1st with homeopathy with me, and on the 27th he was painting his garage. I think no, on the 7th of October he was painting his garage here. And on the 27th, he says that this is the best I've felt in 25 years. So what has happened to this patient since October, since I mentioned it? He feels his brain has returned to 85, 87. That's kind of precise. But objectively, it seems was 82%. It's 5% less. So he has like long-term effect, like numbness. And all of these things would go away. He mentioned that his cataracts in the right eye, the vision in his right eye had improved. He had a cataract. The numbness of the toes, like the long-term effect, were disappearing. Same thing with the finger. But interestingly, here in December, there was he says he was prescribed sulfur, not by me, but he was put back on Carbonium Oxygenator 1M twice daily, sometime in December, and it really helped him. So long-term effect, the Carbonium helped him to really restore his mental capacity, faculty to almost completely normal. What a gift. The improvement with memory and mental functioning seemed quite dramatic to me. So the Carbonium that we suggested would be indicated in the late stage of COVID-19 here, it's helping to recover from the long-term effect of COVID-19. Also, he was having chest pain and throat pain on exertion and also in cold air, which improved at least 40% after the starting to do the Carbonium Oxygenatum. And his blood sugar, he was diabetic for 7 years, have remained normal because he also lost some weight during the COVID, but his weight has remained normal in his recovery. And he's considerably happier since the Carbonium Oxygenatum was given, and it seems more like his old self. And then on December 29th, the report was, that was reported by his partner. He says, I was with him today for a period of time. I gave him the Carbonium 1M at around noon. He had forgotten to take it. He was supposed to take it twice a day. to take it that morning. His nose was quite red and slightly blue. That was a symptom he had during the late stage of the disease. She says, when I arrived. However, by the time I was leaving at 3:45 in the afternoon, his color was drastically better. I asked him to take another dose, which he did. He called me this evening and said that his stamina exercising had improved. He could pedal his bike faster, and the pain he had been experiencing in the throat and chest was also improved. He noticed a real shift taking the remedy twice, so I will be sure to remind him because I feel it will be improving. I reprint this because it's a really typical example of the use of carbonium. People improve with each dose when it's indicated. It's like improvement. It's like each dose is like a little quantum step. January 4th, his mental faculty have made a drastic improvement since he started again the carbonium. His disposition and spirit seems much lighter. So the 14th of January last week is full return of mental function. And his mind was working as well as, if not a little better than prior to COVID-19. That's interesting because a number of patients have mentioned, a number of patients that had more severe type of COVID reported that after recovering from COVID-19, and that goes back to fever is our friend, is that they said that they have felt better than in decades, in many, many years, like 20, 30 years, people will say. Sometimes they'll say this is the best I've felt. And that's not unusual. I've noticed that for a long, long time. For 40 years, I've noticed that. I remember one of the first cases of patient with pneumonia treated. It was a young 25-year-old woman. She had a double pneumonia, 5 lobes affected. And she, after recovering, she says, I've never felt so good in my life. So very interesting after acute condition. So he's also more relaxed, and there's a lightness of being that with him that is delightful. So he's starting to have access to memory that he had not had during the acute phase of the illness. So she says these are the symptoms that have improved: the memory for names, the memory for recent fact, what he was about to do. So the recent memory for words, and that's typical. These are typical symptoms that will improve. Is also his hearing came back completely. He had lost some hearing. So again, the remedy helped. The carbonium seems to help the long-term effect of COVID. Okay, so I will let you. And the diabetic peripheral neuropathy is improving. That is better than before COVID. So his blood sugar is very good. He looks good. He seems to have returned to complete muscle tone. His facial color has improved. So one morning I went over to so that we could sit together with a client, and he forgot to take Carbonium Oxygenator that morning. So I gave it to him. I did observe that he had clarity of his mind and his color improved after taking the remedy. So the hair start to fall, and that's very common after a serious disease, and it's common with COVID. When you have a serious case of COVID, you will lose the hair, but don't worry, they come back. And he has a horizontal indentation in the nails, and that's also common in serious COVID. So you can see that he still has a lot of space to improve, even better than before he had COVID, and he will continue taking the remedy in increasing potency. Now, the patient also presented a very dramatic case of AS who was on a ventilator. He was supposed to be clinically dead, and his wife was asked to pull off the plug, and she reached us. I presented this case at the meeting in the conference in October, and which is accessible on our website on the www.homeopathy.ca. You can watch that, and you can see his wife testifying of what happened. So we last talked about him in October. He was extubated on the 12th. Okay, so on the 18th of October, so 2 days after the conference, that Monday, he came out of the ICU on the Sunday, and he was in a pre-rehab. 3 of his ICU physicians came down to see him earlier today, and they say he was their miracle man, as he was clinically dead and he was not supposed to be alive now, not knowing that homeopathy had been introduced at the time of his turnaround. His voice is clearer. He was continued on ascending potency of the carbonium, and that's one thing that I want to point out here is the remedy. In those circumstances, I changed it about every 5 days. I changed the potency every 5 days to 7 days. So every time we change the potency, there's like a quantum leap also of changes. On October 26th, he's still in pre-rehab. He can sit and stand, but he can't walk or use his hands. He reports sweating on. Okay, so now he has other remedies that help him. Here was calcarea. But eventually he goes back to carbonium 50 and you can see he has a high blood pressure, but it will be controlled. The blood pressure will come down, and then you see like there's only 5 days difference, and he started today with the 75 AM. So as soon as he started, moods are better. He's walking better. The burning in his left hand has not changed. So it was like fire, he used to say. But his blood pressure is coming down. His oxygenation saturation index is quite good. His speech now is perfect. And so then eventually, not too long after that, he started with 125 M because he had palpitation and chest pain, and they are better as soon as he took the 125 M. And he can take deeper breath. This is typical. The post-COVID cannot take deep breath. So here I make a summary of the case. He had to take Spigelia 1 time for a heart symptom, but the hand remained the same of his left hand. Didn't change. So don't be impatient. It will change at some time. So he's taking 150 now, and he reported that the chest pains are 90% better, the nausea is 60% better, and he can go upstairs. It's better. Here, by mistake, he is given the 50 cm instead of 150 or 175, but he improved again, especially on the cognitive level. Yeah, so here I said on January 17, just this week, he reported that the burning of his left hand had improved after an acupuncture treatment from 12, 13 over 10 to 9 of 10. But as he felt that his mental capacity was only 70% compared to before being sick, he was asked to take a double dose of carbonium CM. So here, like I say, he should have taken the 150 because he already had went up that high. That was my mistake. Or the 175, and see if it would improve. And on yesterday, he reported that the burning of his left hand had improved from 910 to 45. That's without an acupuncture treatment in between. There was none in between. And his mental capacity had improved from 7 to 8 or 9 out of 10. That means 10 is perfect. Now he was told to take carbonium 150 M and report in 1 week. The important point is that the patient is continuing to improve as long as he's continuing treatment with from the long-term effect of COVID and intubation. So like chest pain, palpitation, shortness of breath, hypertension, paresthesia, paresis, energy, diabetes, all these, it's all improving. So beware that the remedy must be given often. Yeah, so a patient will say they feel better after each dose. Many patients have said that. It's exceptionally for this remedy. When they wait before repeating, or when they stop, when they stop improving, they either stay at the same level. So sometimes they forget taking the remedy, they stay at the same level, or they start to deteriorate. As soon as we resume the remedy, they improve. Okay, now, one of the purposes of this conference was the Omicron phase of the epidemic. So in the last month, I was consulted by 26 patients in areas where Omicron had begun to be dominant. You have to understand, when Omicron comes in an area, which is all over the world now, after 2 weeks, it's more or less 50% Omicron, 50% Delta. After 3 weeks, it's like 90% Omicron, 10% Delta. After 4 weeks, it's like 99 Omicron, 1% Delta. So whenever Omicron comes in the area, after the second week, it's dominant, and after 4 weeks, it's almost only Omicron. The symptomatology was completely different than the one of the original Wuhan strain and the Alpha and Delta variant, in which Brian had been indicated in about 65 to 70% of my patients. With the Omicron, 24 of the 26 patients with confirmed or suspect COVID, tested or untested, in an area where Omicron variant is dominant and had more or less the same symptom, respond quickly to Carbonium Oxygenator. Very important. We thought that this remedy was the remedy for the late stage, but here it appears that it's for all the stage of COVID. And that's important to spread the news, not the news, this observation to all your colleagues, because you would save a lot of time, especially if you can recognize the picture, and I'll go over the picture soon of Carbonium. I did add the monograph of Carbonium in the handout. The 2 cases out of 26 that did not require Carbonium were a patient in Greece with MS and one in Illinois with lupus, who both contacted me about 10 days or so days after they started to be sick, and who had been repeating the chronic remedy. One was sepia and one was calcicum, more often for the acute manifestation, and they felt that they were recovering well by the time I reached them. So I said, don't continue just taking it. Maybe they came out more slowly, probably more slowly than if they had been taking the acute remedy. So what's the rule of success to deal with patients with COVID-19? It doesn't change. It's always the same rule as for homeopathy: a thorough case and taking and examination of the patient. So when I do this, if it's an acute case, I don't know, it's not a patient of mine, I could do it in 10-15 minutes. Sometimes it's always better to have the chronic case. So some people that have a complicated case, they don't have a clear picture, it would be decided by their chronic symptom prior to the COVID. So then it's a longer case, especially for the long haulers. The long haulers, you'll have to take a chronic case. But for just the acute, a short case can be enough. You can easily find the remedy sometime in few minutes. Objective case analysis. So beware of the sine qua non. I see too many people referring patient to me, or patient coming to me from other practitioners that have been prescribed remedy that are not indicated, and because they don't understand this clause, the sine qua non clause. So the sine qua non clause was explained by Hahnemann in many places, but more specifically in paragraph 213 of the Argonaut. He says this remedy can be used with this, and this remedy cannot be used with that, and so on. So there are sine qua non that are very applicable to this epidemic. For instance, Don't prescribe phosphorus if the patient is not very thirsty for ice cold drinks. So if the person says, oh, I like to have my tea, my hot tea, don't prescribe phosphorus. If they say, no, I don't drink too much, it's not phosphorus. So they must be very thirsty and they must want ice in the water. Sometimes they're not sure. I say, go to the sink or to the fridge, put some ice cube in a glass, put some ice cold water from the sink or from the fridge into the glass, let it swell so it becomes very cold, and take some cold water and take a sip. And I ask them to score it on a scale of 10, the satisfaction. So they take a sip and with cold water. I said, try one with room temperature. They take a sip, said, oh, maybe a 3. And they take with a cold, they say, oh, maybe a 6. And I say, try the ice cold now. They say, oh, 9. So 9, that means they're better with a cold drink. They like it. However, if you have somebody that you think they need phosphorus and you ask them to take room temperature, it's okay. Oh, it's not phosphorus, especially if it's warm. The warmer it is, the worse the phosphorus will take it. So if they like the warm drinks or they like the room temperature, it's not phosphorus. So don't prescribe phosphorus. Or for arsenicum album, if the patient don't want the room very warm, like above 26 degrees, especially when it's cold outside, don't prescribe arsenicum. Don't prescribe brownia if the patient is not better from a steady pressure. So if they have a headache, I always say, put your hand over your head and press steady and tell me what happened to the pain. They say it's no change or it's worse. I don't prescribe brownia, even though it was well indicated, because I know it will not work. Same thing with gelsemium. If the patient said they're very thirsty, don't bother with gelsemium. It will not help you. Even though you have a nice picture, looks like a nice picture of gelsemium. Yeah, so I always prescribe the most similar remedy for the totality of the characteristic symptom found in the patient. Only prescribe the remedy as a rule that you have developed a gut feeling. You see clearly, you have a gut feeling, there's no sine qua non that are contradictive, and you have ruled out other competitive remedy. After taking a good case, examining, prescribe that remedy. So not routinely. Here's a good example of not prescribing routinely. This is the husband of one of my patients. He's 60 years old. He's a bit overweight. And so he got COVID. And yeah, he's overweight. He was anxious and very anxious, his wife says. She could see in his face the anxiety and so on. And he wanted the room, he liked when it's very hot, like 80 degrees. So I told him to get arsenicum. They had a first aid kit, a home kit with 6x. So I said, yeah, give it to him a teaspoon every hour for 6 doses. And he was better with the 6x, and so on. But then, and his oxygenation was, he was ready to go to the hospital, but they didn't want him to go to the hospital, but his oxygenation was 73 to 88. Usually they recommend below 90 to go to the hospital. But he stayed home. He didn't want to go to the hospital. And after the arsenicum, they went up to 93, his oxygenation saturation index. Then he reported that he was blowing from his nose he had blown 2 1.5 inch long dark red brown hunks from his nostril and one from the right, big plugs. So I told him to switch to arsenicum 30. As soon as it would arrive, he improved a bit, and then he started to pull out 3-inch plugs. Then I switched to Coccus cacti, which was very well indicated, but it took, you see, that's the problem when you don't have the remedy. They ordered on the 17th and they got on the 26th. So 9 days later, he got the remedy. He takes it. He says, as soon as he took it, he says, he felt awesome, his wife said. The next day, he felt even better. And on the 28th, he felt his best. As soon as he began taking Coccus cacti, the large clot started to come out from his sinus. They fade away. No, coming out of his sinus fade away. So Yeah, so he was 9.5 his energy after 1 month later. So this is a case that avoid a hospitalization to save a lot of money to his insurance company, I guess, or the system. And I barely participated in his recovery of his wife. His wife got COVID too, and she self-treated herself, and I barely did anything. So a lot of people that have kits at home can be very useful. So it's important to use the optimal posology. Different practitioners would use different potency. Potency, repetition, and way of administering in water or in pills and so on. So this is really a matter of experience. It's interesting, Betsy Bevan again, from Machine, she says the higher the potency of brownia, the faster she saw results. So she asked people to have the higher potency at hand. At the beginning of the epidemic, she was asking for the 1M, but now she's asking for the higher potency. The other thing is when to follow up your patient. So you may want to follow your patient within a few minutes after you give them the remedy. You could say, take the remedy every 5 minutes for 3 doses, and I'll call you back. Or just take a dose now and see what the oxygenation saturation index says. Because if you give the right remedy, the pulse rate and the pulse rate and the oxygenation index will change almost automatically. That's what I say to people in the intensive care unit. Watch the monitors in the intensive care unit when you give the remedy. See if it affects the signs right away. And we have to remain very vigilant with because it can be serious. I keep saying nobody should die of COVID-19 under the care of a skilled physician, and this is our experience. However, there were two well-known teachers of homeopathy. Robert Murphy, who was one of my earliest teachers, and Praful Yakar also passed away from COVID. I don't know their circumstances, but listen, we have to take that seriously when 200 pets die of COVID. So what you want to make sure they have access to the remedy before they fall sick. Because if somebody calls on a Friday, by the Tuesday to get the remedy, it could be late. One thing that was reported by Lisa Amarin is that under homeopathy, people recover fully. I didn't think about that, and I realized that she was right. She's right that our patient fully recovered. You saw the patient with the ventilator; it continued to improve. There was a study that came out that showed that 54% of people that had COVID-19, of which 79% had been hospitalized. So it doesn't mean they were on a ventilator, but 79 were hospitalized, so there were more serious cases of COVID. 54% of these, 6 months or more, later, they still have problems such as neurological disorder, mental health disorder, functional mobility, constitutional symptom, pulmonary, like we had in our patient AS, like chest pain, difficulty taking a deep breath, fatigue, weakness. All of this we can clear up with our remedy. But 6 months or more later, 54% of people still have problem. And that's a very good point of comparison. So here said the causes can be due to viral infection, like the neurological disease, or to the effect of post-traumatic, or to loss of employment. There could be many reasons. Also, like the intubation is not very healthy. Let's put it this way. So this is from the study. Here is the reference of this study here. Short-term and long-term rate of post-acute sequelae of SARS-CoV-2 infection that was published in December 2021. So the author of this study, they say, these long-term persistent post-acute sequelae of COVID-19 effects occur on a scale that could overwhelm existing healthcare capacity, particularly in low and middle income countries. Yes, we can avoid that with homeopathy. So, but I guess it's the best kept secret because they didn't mention it. They should have put a little asterisk. Oh, yeah, but it doesn't happen with homeopathy. I guess they don't know about it. Why? I guess we don't make any noise or we don't educate enough. Okay, let's talk about Carbonium Oxygenator. We did a proving in April, May 2020. So when the epidemic began, we suggest to use this method, but the proving was not very good. The intoxication was incredible. There was a lot of cases of intoxication. You have to understand that in the United States, there's about 50,000 people go to the emergency room every year for carbon monoxide poisoning. So there's a lot of published case and reported, tons of it. So I reviewed the literature on it, and lo and behold, it looked exactly like COVID-19. So we decided to prove it. And the interesting thing is the following: is the proving confirms the intoxication. Is the proving confirms the intoxication and the cure case. So that's very interesting. Usually it should be the opposite. The cure case confirms the intoxication and the proving. No, here's the proving that came later, confirm the symptom of intoxication and the cure case. So to the dot, very, very similar symptomatology, all three. They fit together very, very well. This means that the proving was a great success and very well conducted. So whoever did this proving, in French we say mon chapeau. That means you did a very good job. So carbonium has been used successfully for the long-term adverse effect of vaccination. That's important to point out because it seems that it's addressing the S protein that is in the vaccination. That's what is the toxic part, and the Carbonium Oxygenator and the pathology of COVID and the Carbonium Oxygenator pathology of carbon monoxide poisoning, they're very similar. In other words, the carbon monoxide poisoning and the S protein pathology are very, very similar. And especially during the consequences of COVID-19, as we saw before, especially with the Omicron variant. Omicron variant fits for all the stages. Of the Omicron variant. Oh, this is, yeah, I mentioned before, a number of patients that said they felt better than before getting sick. And the number of these cases was related to taking Carbonium Oxygenator. Very interesting. One patient, I cannot recall now, but I remember one patient saying, oh, he had a history. Now I remember what this. It's KD, the patient that was very sick, had a history of carbon monoxide poisoning early in his life. Oh, this is very interesting. One lady who is a writer continued to take Carbonium Oxygenator after having almost completely recovered, and reported that hours after raising the potency from 10 m to 50 m of Carbonium Oxygenator, she had to write an essay for a magazine, and said that she had a surge of great intuition and creativity with a desire to write, which she did with unusual sharpness and concentration. It came so easily, was her words. In other words, the Carbonium Oxygenator seems to have improved her capacity to write better than normal. I want to go over the most characteristic symptom of Carbonium Oxygenator with this Omicron phase of the epidemic. So first, the great to extreme lethargy. grade to extreme apathy, loss of will, mental dullness, frustration, confusion, weakness, great sleepiness. Some people sleep almost 20 hours, and extreme shortness of breath that are worse from the slightest exertion. So the slightest exertion is for all these symptoms. All these symptoms are worse from slight exertion, and all these symptoms are better from open air. But they don't know, maybe they don't know. You have to remember, with carbon monoxide poisoning, people know they're dying from carbon monoxide because they suspect it, they can see it. There's a stove, there's fumes. They know they will be dying, but they don't leave the room. They have apathy. Somebody else has to come and pull them out of the room. And same thing with people with that needs carbon monoxide. They have that state of apathy. They know they have to do something, but they don't do it. Another interesting symptom with carbonium oxygenatum that indicate carbonium oxygenatum is disorientation in time and space, and awkwardness. So this disorientation in space and time is they feel the time is too short or too quick, or they cannot remember which year it is, or if it's morning or evening or night, or it's a long time they did this, or it was just 10 minutes ago, but it was yesterday, or space. They don't recognize places. Like one person say, I've driven the road from my home to my clinic 1,000 times, or 1,000 times a year maybe, and I couldn't remember. I would come to a stop. I didn't remember if I had to turn left or right, but I'd driven this for years and years and years, every day, and couldn't remember if it was right and left. So it's spatial, and our awkwardness, dropping things, hitting things, stumbling, poor coordination, very, very common, these symptoms. So a patient can have a panoply of other symptoms like cough, sore throat, sore skin, painful joint, fever, chilliness, high thirst, but none of these tend to be decisive to find a remedy. You won't find it from the thirst, you won't find it from the chilliness or the fever. You'll find it from these general symptoms, and also the slightest exertion and the better open air. The better open air, they may not know about it, though. It's only when you ask them to go to the window, oh, they say, oh, everything is better. The state of apathy is very particular to carbonium oxygenatum. One patient who had been in bed for 13 days said, I know I have to go to the washroom, but I get so exhausted from just thinking about it that I don't go. She said that once she waited 4 hours to get up to go to the washroom. So she knew she had to go, but it took 4 hours for her to get. She took carbonium 1M around 1:30 in the morning one day. She was told to take every 30 minutes, and I would call her back around 1 after 4 doses. And she said, she reported that she felt so well after the second dose. So that means at 12 noon, she felt so well after the second dose that she got up. She got she got out of her pajamas that she had been in since December 24, so for 13 days. Took amazing, eh? Took a shower, got dressed for the first time, and prepared herself a meal for the first time in 2 weeks. Because before, she couldn't even think of making a meal. It was too exhausting. So here I said that it was first thought to be for the later stage of the disease, but a colleague in Holland had found the genus epidemicus during the delta phase in his area. So it says that was the delta. You could prevent it, and you could use it in the early stage. Now we know for the Omicron, it's the remedy, at least so far. So it may be difficult for most to prescribe carbonium, as it won't come out with representation. For instance, in the complete repertory 4.5, there's about 200 addition there's 200 entries, and we have about 2,500 entries. So we made it about 22 edition. It's 22 here, should be about 2,200 edition that were taken from a review of the toxicology. So the old toxicology was done, and the excellent proving done by the MMPP in the spring of 2020. So let's look a bit about this monograph. So here's the monograph. So you will see your appreciation is very long, 275. You have the proving. The proving is in there. The genius, if we look at the genius, it has not changed since we made the genius. So it's just been confirmed. It says here, at this point, the essential of this genus is a chilly person. That we find out also clinically, they're very chilly with the COVID. Men tend to be quite tired and apathetic. So there you go, as in the intoxication, and desire fresh air and are better in fresh air. Take deep breath as if from shortness of breath. Is worse in hot weather. So this we cannot say right now because there's no hot weather in this hemisphere anyway. Worse from exertion, becoming physically weaker with exertion, and is better from rest and sleep. So they have flu-like illness. They have symptoms as flu-like illness. So rigor, fever, great exhaustion, difficulty breathing, and so on. Change strokes, all the symptoms we have seen this so far in this epidemic. And I also make a comparison with COVID. Here, comparison with COVID-19. So you can look yourself. It's a long comparison, like both have bloody sputum, both are have marked hypoxia, both have shakiness and faintness and shitter. You can look at this on your own leisure. So it might be difficult because it will not come out in your repertoire because you don't have all these additions. So use the monograph, see if it fits. So these are the other symptoms that have been cured in the patient with COVID-19 that confirms the proving and the intoxication. So here's another list of symptoms that you can, like for instance, cough, worse, deep breathing, no appetite, chest pain, worse, coughing or taking a deep breath. I should say here, and chest pain from coughing and taking a deep breath. Continued low-grade fever, so they could have like 1 degree, half a degree temperature for a whole week, 10 days. We'll take this out, and better, yeah, they're better from sleep and siesta. Michel de Sonneville shared a lot of experience with COVID. He had 25 patients with Carbonium Oxygenator. I will let you read this. So he says, I prescribe when there's extreme exhaustion, resignation, or apathy. This confusion, resignation. He calls it resignation, but we could call it apathy. He says the remedy must be given often in the acute, and that's correct. In all stage, actually, you must and change the potency. He says 2 or 3 times a day. In severe patient, 2 times a day, 3 times an hour. You could do it more often than that. I'll show you what Dr. Gupta did in India. It's very different. So the relapse, you should try to avoid relapse. That's because you didn't instruct the patient to take the remedy on a timely basis. Yeah, here he says it seems to be the genus epidemicus. That he said that in the summer. It works well in the long COVID and in the acute form. In the acute form, it was given often. So he gives all the symptoms that he saw that have improved in his patient. I'll let you look at that. It's a long list. So the prevention of Omicron. So whenever Omicron became dominant in an area, I was telling my patient to switch from Brownia to Carbonium Oxygenator for prophylaxis. And in the early stage of the disease, and also to take it in the early stage of the disease, and to call me if they don't respond, if they didn't respond. People who were taking Brownia for prevention were told to stop taking it and take instead Carbonium 200 or 500. We use the 500 in office. We don't have the 200. We have 30, we have 6, 30, 500, and up to 200 M. Every 2 weeks or so, depending on the exposure. You know, some people would be every week, and some people would be every 6 weeks. If someone know they have been exposed yesterday to someone who was diagnosed this morning, so let's say yesterday I was with somebody, and this somebody calls me today and says, I was diagnosed this morning with COVID. I know that tomorrow I'll be sick with Omicron. So they are likely to develop symptoms that day or the next day. I recommend that they take Carbonium Oxygenator 200 or 500 twice a day for 2 or 3 days. No problem after that. But if it's too late, they already feel like the flu-like symptom, I ask them to take the remedy every hour for 3 doses and to keep repeating this every hour for 3 dose regimen whenever the symptom wants to come back. However, if it's too late, they have a full-blown case of COVID, they have not taken the remedy earlier, they have forgotten, they were traveling or whatever, and the symptom, or if the symptom keep relaxing, to go up to the 1M, take it every 20 minutes and call us right away. I had only 1 case of COVID this last week, which is very unusual because the previous 2 weeks I had 12 each week about. Why did it drop so quickly? I don't know. It's still going up in the world. But one patient told me the following on yesterday. She said, my husband, actually with her boyfriend, my boyfriend went with his friends on Friday night, previous Friday, a week from today. So they went out. She didn't tell me if anybody was diagnosed with COVID, but she said he started to be sick on Sunday night. So I gave him the Carbonium Oxygenator because she had it at home. Because she's a patient of ours and she was notified about it. And the next morning she woke up and she had flu-like symptoms. She took it. So by the time I talked to her on Thursday, she said, my boyfriend took the remedy 3 doses on Sunday night, and he woke up on Monday morning. He barely had the sniffle. He took another 3 doses. He's fine now. And I had flu-like symptom on Monday morning. I took the 3 doses of Carbonium, and I repeated again, I think the next day, and I'm fine now. So we didn't hear about these cases. We were doing our chronic follow-up. So we didn't hear about this case this week, case of Omicron, because maybe many people know about it and they are already taking the remedy on their own. Dr. Pradeep Kumar Gupta put an update on January 11, and he wanted to put it out, and he says the following. He says, it started to hitting hard at the beginning of 2022, but the pure clinical experience of 803 patients, quite a lot of patients, in this hospital so far has proved that this variant is very easily curable by heparin sulfur LM or 200 in water. So he used the LM for hospitalized patients according to previous experience. He said, I asked him to send me more information and he didn't answer this time, or he never. I sent him an email and says, can you give me, I'm doing this conference, can you give me some more more information. I didn't get an answer, or maybe I didn't see it. Or for the outpatient clinic, he gives the 200. He also found brownian and arsenicum useful, but see, he doesn't know about carbonium. He also used gelsemium, and he says we use strict individualization. I'm happy to say in clinical trial of COVID-19 patient in June 2020, I suggest this remedy in my first article in June 2020. The clinical experience has shown that these remedies were extremely useful in the first wave. The Brownio alba was the best remedy for the first wave and also for the deadliest second wave in India, along with arsenicum album in May 2021. I have some more study of them from May 2021. I, in my hospital, been using these two remedies, was able to save thousands of lives in my country and especially in my city, Agra. Currently, the Omicron is very effectively curable by these medicines within 2 or 3 days. So please don't be fearful of by Omicron or any COVID variant that may hit the future. He's a real Hanuman. Here, I want to say that this fact that the symptoms are the only guide to curative remedy in each of all conditions. If anything change in future, I feel duty bound to update it. So that's why he put this thing out. He's very dedicated practitioner. So Dr. Gupta reported having treated 12,000 COVID cases in the inpatient and outpatient department of his hospital with only 2 deaths. Actually, it's 3, I think. I'll put 3. I saw 2 one place, and another place I saw 3. So I'll put 3 because to be more on the safe side. He gives the remedy in either the LM potency every 10 minutes, the first day for the inpatient patient, the first day for the inpatient patient, so the patient that are, or the centesimal potency for the outpatient patient, so the 2 to 6 hours. He also said that he gives the LM every 5 minutes for 4 doses in the severe cases. So he gives the LM every 5 minutes for 4 doses, and then 4 doses more every 10 minutes, so 8 doses for the first hour. The point of this is that the posology is important. That's me talking. So posology is very important. Often the potency you're going to be using, unless the patient is very sensitive, I give the 1M every 15 to 30 minutes at first, and the patient may keep doing this the first and second day. So me, I go with the higher potency less often. A patient said last week that with each dose of carbonium, she felt a surge of energy that begins within seconds of taking it. Many patients actually have said that, but when I wrote that, it was a week before probably. Yeah, and I also change the potency about every 5 days during the acute. Period, phases, stages, which every time you change the potency, like they move a step forward. Here, Anton Rohrer wrote about 2 cases of oxygenatum. He says, Anton Rohrer is a very good practitioner from Linz, Austria, one of the best in Europe, and very knowledgeable physician. As you not only speak in your webinar about prevention, but also treatment of COVID, I want to report to you that because of your lecture of Carbonium Oxygenatum, 2 patients were saved by this remedy. So very similar to ours. A 72-year-old, 5 weeks in intensive care unit with a tracheostoma, breathing machine, fever, pneumothorax, I guess a suspected pneumothorax. After starting carbonium 200D, he recovered. I could not get any significant relevant individual information further. The doctor said nobody of this age and this severity could normally survive such a bad condition. Imagine if all the people in intensive care unit all over the world were giving carbonium oxygenatum routinely, or even before they enter or as soon as they walk into the hospital. How many thousands or millions of people would have been saved? I tell you, a bit of education can go very far, and a bit of how can I say, ignorance can create a lot of damage. He gives another case, 73-year-old. This one was in June, the first one was in January. 3.5 weeks in intensive care unit, coma, cannot get awakened, paralysis of all extremity, severe lung damage, recover after carbonium 200C. Also, no individual symptom to provide. So just give it routinely because they had no other symptom to give to prescribe. He says it's as difficult to get homeopathic relevant symptoms if the patient are already such a long time on the breathing machine. Both wives of the patient also did not know relevant symptom of the onset of the disease, except that they got breathing problem and they were sent to hospital. But I think carbonium oxygenatum, actually it's not the way it's spelled, really covers well the late stage of disease, but now we know more. And then you report that many cases of people that remain weak recover under picric acid. And this says there's 63 patients that were reported in Austria by Austrian doctor. And then he gives in a nursing home, picric acid was given to all the patients. 31 of 36 were positive for COVID. 3 died. And in that one, 1/3 of the patient died where they didn't use picric acid. So with picric acid, they save a lot of lives, apparently. So another unit, they use picric acid and only 1 person died. So here 1/3, here 3 out of 31st, like 10%. Here is 1/3. Big difference, typically. Nancy Boyer also reported a case of a patient with an ICU on ventilator with kidney and pulmonary function failure. The holy water approach was given, like we did with the patient with the ventilator. The patient started to respond. He came out. He started to produce urine. He started to function, but then they threw the lady out of the emergency room. He developed pneumonia, fungal pneumonia, like hospital acquired pneumonia, and he died. And she says this is a good testimony of the greatness of homeopathy and the failure of the hospital system. Absolutely. A big contrast. I can't remember these cases. So there are 2 other Omicron cases treated with carbonium. So I'll let you read them. Okay, so this is a patient that had was sick for 2 weeks, I think. 2 people, myself and my husband, and they took many remedies and numerous others, no benefit. They hear about carbonium and they had extreme lethargy. I spent many days in my PJ, like the previous one, many days in the PJ with no interest or motivation to shower or get dressed. I could barely prep food for myself, similar to the previous patient we saw. The slightest movement was daunting and felt very effortful. The previous patient said, just thinking of getting up, I was exhausted, just thinking of getting up. If I thought of doing something, just about the idea of making an effort was exhausting. That's peculiar to this remedy. She just stare. She lost a lot of weight like the previous patient also because didn't eat. So in desperation to the Carbonium, she had the 30 and into my symptom into instant increase. So she lied down, she got worse, and anyway, so I'm not so sure, but anyway, she had a remarkable improvement. Same thing with her husband: extreme lethargy, low-grade fever, dramatic uptick in energy for him when he took the remedy. So yeah, she says, but we stop improving. Yeah, they stop improving because they should have raised the potency. So 30 was not enough, or the frequency. Oh, Irene Sebastian, let me see how we're doing in time. Okay, so I will point out some interesting aspect of Irene case. Irene had two cases, two very severe cases of COVID. One with hemorrhagic stroke, a 74-year-old woman. Very interesting. Please read it. I will not go over that, but she noticed that she had had a craniotomy sometime with aphasia earlier in September 2020, and she was then she got COVID in the hospital. So first she had the surgery for the craniotomy. So she noticed that the patient had the lower lip would turn outward and will swell. It was noticeable but very subtle. I recalled this symptom when reading the Mathematica on the Carbonium Oxygenator in Allen's Encyclopedia. Quote, the lower lip immensely swollen and turned outward. I gave her a dose of carbonium 30. Her oxygen sat quickly decreased. I right away antidoted the running. The next day, I suddenly realized that she needed arnica, and she gives the reason. She says she was fine. There was nothing wrong with her. She was very suspicious. She refused to take the medicine. Symptom of arnica, rage. She was enraged that we told her what to do. Because of this, she gave her arnica 30. Her oxygen saturation immediately increased. See what happened with the right remedy? I repeated, and when the saturation began to drop, I increased it again, and she gave it the 200. The saturation continued to improve. She commented that her head was sore. Remember, she had the craniotomy. After taking the 200, she became cooperative because she knew she was sick. Remember, before she didn't think she was sick. Later that day, she suddenly began to weep and said in a very sad voice, I'm not well, I'm dying. I then thought she was also out of the arnica state. I changed the remedy back to carbonium, and this time her oxygen saturation index improved. I gave her 2 doses followed by carbonium 200, and she continued to improve. So anyway, very dramatic case. Read it, very interesting. And she says using the pulse oximeter was extremely helpful because it was objective evidence that she was improving or deteriorating. I will not go to bed unless it was 99, above 90, 93, sorry. Her second case, again, a patient that with encephalopathy and cerebral stroke after getting many comorbidity before COVID, but with COVID, developed a cerebral stroke. Encephalopathy is pulse went down to 57, so probably like he was going into heart failure, and he also had the lower lip turned outward and swollen. His was very noticeable and constant. So she prescribed carbonium 30C, and the pulse increased to 80 from 57. When it dropped again, I repeat the carbonium, the pulse increased again. He was taken to the emergency room and was hospitalized. The ACU doctor asked his operation for ventilation. He agreed, but they said they would monitor him. So his oxygenation was in the 70s upon arrival. Visitors were not allowed to the ICU, but I told the family to put carbonium 200 in a bottle of juice, and he was discharged without going into the ventilator. The ICU doctor told him that he had not expected him to live. Another case that was saved. He had a history of deep vein thrombosis and pulmonary embolism. So he's got combination. So you'll have to read it. So here she gives Carboveg 30 because he has symptom of embolism. And as soon as he took Carboveg, not Carbonium Oxygenator, he was 20% better. And she suspected that he had a pulmonary embolism. In any case, it's more complicated than that. And they figure out with an MRI that he has a cerebral stroke. She gave him Iosiamos. There was no visitor allowed, so it was very difficult to treat him. He was combative, and she saw that he had, when she went to visit him at the hospital, he had status epilepticus. So she said she would apply a cold compress for the purpose to give him stramonium topically. So he started to get better with stramonium. Anyway, you will have to read the case. It's interesting, but it was finally with Iosiamos that he got completely better. And she also gave him opium. Very interesting case. I summon you to read it. As you see, he had ileus and sheen stroke breathing, and opium helped him. So his final diagnosis was COVID, encephalopathy, and cerebral stroke. For the second time, a doctor had told him that he was not expected to live. Here are other interesting observations and cases. Sharon Sheriff is a homeopath from Washington. He wrote that during the Delta phase in December, he was still using brownia. He says 20 cases of COVID in 1 week, all brownia, for most part, mostly brownia. He gives a very critical case that was saved with antimonium tactaricum. Let me see how much time do we have. We have some time. So I will let you read this case. Another interesting observation from Dr. Germany, in Western Canada, in Eastern Canada, in the UK, that people, one or more of their patients likely had COVID-19 2 to 3 months before it was actually arrived in the country. Yes, it's very likely. It's interesting to note that China ordered PCR equipment in August 2019, that when there was the military Olympics games in Wuhan, China in October 2019, once the military went back to the country, they reported feeling very sick, flu-like symptom. It's interesting that in October 2019, 6 of the Wuhan virology lab were hospitalized and with pneumonia, a strange type of pneumonia, 3 of which had died. It's also strange also that there was a summit to practice a corona pandemic in October or November, in the fall of 2019. There was a summit with the World Health Organization to practice for a corona epidemic months before it was announced. Very strange phenomena. It's very strange that the US government gave grants to the lab in Wuhan, for the virology lab, for research on gain of function of the virus. I mentioned that in the paper, in this paper. No, this is the book. Let me see, the paper is that I gave you. Maybe, oh no, it's this one. So in this paper, it's called The Risk and Benefit and Risk of COVID Vaccination. I talk about the key influential player. I talk about the good old medical profession, but also the corrupt and fraudulent vaccine industry, complicit government. I mentioned that in the complicit government that sponsor gain of function research. It's all documented, and the corporate media. Let's we put gain of function. Let's see what happens. Gain of function. There it is. Yeah, because of the ineptitude of conventional medicine, the entire campaign to fight what appears to be a man-made gain of virus. I give the reference here of all this stuff. It's very clear that it's probably that's what it is. It was sponsored by the U.S. government. So both China and the U.S. government don't have intention to publish that. Other interesting intervention. A practitioner from Germany says only one patient out of 1,000 is using brownia for prevention. All the other ones use their constitutional remedy. Another one from Germany, he says, I have some patient with COVID-19 in the last week, all got their chronic remedy, chromium, phosphorus, sulfur, and they're fine. Dr. Rivar in Northern Ontario during the beginning of the Omicron, she reported people with sulfur, and people that had taken sulfur for other conditions did not get Omicron when they were exposed. Gwen Grana is a homeopath on the East Coast of the United States. She practiced in a COVID clinic, and she does over 300 cases. She mostly prescribed Pulsatilla and brownia with the other following remedies. She says people that were taking ivermectin did much worse off compared to those just using homeopathy. I believe that. Steve Coward is a practitioner from North Carolina. He says for people that have recovered from COVID, but still have not recovered their taste and smell, he found Nitromur if it's wet and UPC. If it's dry and stuffy, he gives them sulfuric acid. I've gotten people's symptoms better quickly with both remedies. Smell and taste generally returns in 5 days to 2 weeks. Says secondly, I have a lot of patients of late who have needed heparin sulfur. That would be in the fall, so it's not for the Omicron. This has not been the case until recently. So he gives a symptom. Christopher Aberman from Vienna reports that lobelia purprescent has been one of the main remedies used up there during the entire epidemic, and he gives a symptom which is very difficult to prescribe: great weakness, feeling of not being able to breathe completely, difficult, similar to carbonium. Tim Fior from Chicago reported sometime he would switch to Carbo Vegetabilis, and within a couple of minutes the oxygenation saturation index would go up. So sometimes he had better response with Carbo Vegetabilis. Read his note. Here, a practitioner from Edmonton, Elizabeth Schultz, she was an excellent practitioner. She responded that 60% respond well to brownia in 30 patients that had PCR positive. Shamsef shares some notes on brownia, so I'll let you read it. Long hours. Long hours. Okay, very good. As far as my experience goes, long hours have responded well to the remedy they needed when they were in the first stage of COVID, such as brownia alba, or in the later stage of the disease, such as Carbonium Oxygenator, or to the remedy they needed before they fell sick to COVID, which is a good example of individual susceptibility to chronic disease, as it was originally reported by Hahnemann in his chronic disease. Practitioner will have the same success with these cases as they will have in their general practice. So if you don't have success in your general practice with chronic disease, you will not have success with long COVID. On the other hand, if you have a lot of success with these patients, you will have a lot of success. So it's a question of being alert, taking all the case from before COVID, during COVID, after COVID, and figure out, do they need the remedy they need of the last stage, the first stage, or their chronic remedy before they fell sick. Interestingly, as soon as the correct remedy is given, every symptom begins to improve in a progressive manner, even though the patient may have been in a weakened state of health for many months and up to 1.5 years. So some people have been almost bedridden and non-functional for 1.5 years. You give them the remedy and they start to improve the next day, and it's progressive. I can recall a long hauler who began to come out within 15 minutes of brain fog and physical exhaustion that she had been experiencing constantly for about 9 months after taking a single dose of Carbonium Oxygenator 1M. Within 15 minutes, she says, I'm coming out of it. But she was there for 9 months. Imagine how people would benefit from homeopathy if it was accessible to all. I therefore recommend all my colleagues of a careful study of the mathematics of Carbonium Oxygenator, as its pathology is most similar to COVID-19. So many of the sequelae and the effect of vaccination too. So now I said I'll put the monograph available, but now we have a possibility to give it to you through GoToWebinar. So you should have the monograph in the handout. I would just want to, yeah, it is there. So many other colleagues have reported similar success with long haulers. Here is Carbonium. Here's Brownia. Carbonium again. I think here was all Carbonium. It doesn't say, but oh no. And then I will switch them to the constitutional remedy. So all 5 will be improving with Carbonium, and then you would switch them. So the same rule apply for the people that have been damaged from the vaccine. Same rule as before. Betsy Bevan again report another following interesting observation. Just for you to know, someone contacted me who heard your October 16 COVID-19 update, which was free to the public. She had COVID-19 in January 21. She got over it easily on her own, then received COVID-19 vaccine in February. After the vaccine, she spent the next 8 months in a COVID-19 fog, no energy, body aches, and a feeling of hopelessness. She heard about me and booked an appointment. In the meantime, she got access to your webinar and felt Brian could help her. She ordered, took it 1 dose of 1M, and the next day was 75% of her symptoms were gone. She felt a miracle had happened to her, and she had never done homeopathy in her life. It was all because of listening to your webinar. Just want you to know how valuable the information can be. Yeah, spread the information. People need to know this kind of stuff. So finally, I start early advising people to take Brownia before the vaccine, not leave them. Right afterwards, another dose that evening. Most people did well or had minor problems. So some people have done it with Lidon, some have done it with Arnica, some have done it with Carbonium Oxygenator. Shamsera from Kent, Washington wrote, as a side note, now that we are talking about Brownia, it's appropriate to say that in my experience, Brownia appears to be amazing for most cases of long COVID or even post-COVID vaccine reaction. From what I have seen, Brownia appears to be at least very helpful, if not right on for most such cases. Okay, back to Dr. Gupta in Agra. Dr. Gupta is a phenomenal doctor, very disciplined, works clearly according to Hahnemann the Argonaut. He has a hospital, a school of medicine, many residents to help him. So in April and May, conduct a study for 32 consecutive days. He treated in this department 5,100 patients with COVID-19. After the first week, 86 had recovered, 13 were better, and 1% had not improved. Of 183 patients that were admitted to the hospital, 117 recovered, 56 were still under treatment. So these are people with severe SARS. 3 had died, 4 had been referred out, and 3 who had improved but were discharged on patient request. So very good outcome. Average hospitalization day was 5 days, which is much, much less than in conventional medicine. However, by October 21, Dr. Gupta and his team were reporting having treated 1,200 or over close to 1,300 COVID-19 patients with 99.11 recovery within 15 days. He mentioned in 2 different presentations, different pathology protocol. I've mentioned it a bit earlier. For the outpatient, he gives the C potency. And for the hospitalized, he gives the LM potency every 5 minutes. I've mentioned it before. For prevention, he used bryonia. He says on June 11, 2021, he says that's his hospital, Nimanat Hospital, is one of the famous hospitals in Agra. This was has cured more than 12,000 infected in the pandemic. Many hospitals took bills of lakhs of rupees, like I think this is 100,000 rupees from patient in the name of COVID. Yet my patient, now they will ask a lot of money. Many other hospitals, yet the patient lost their life due to lack of proper treatment. The hospital has been treating complex disease with homeopathic medicine at very low cost. Gupta has one motto: nothing is incurable. He's an incredible doctor. He has tons of cases of cancer and serious disease reported in his hospital. American Institute of Homeopathy kept a tab of case being treated. This is not up to date. That was up to date maybe a while ago, but 31% of the case had taken bryonia, had cured with bryonia. And then you see 18% now for arsenicum, 7% pulsatilla, gelsemium, 6% with phosphorus, and down like this, and others 16% here. On the other hand, from a Germanic group of physicians, out of 61 patients, 11 got lobelia preferescens, and which is not here. So that's why I'm reporting it. Okay, now we come to one of the last points of this presentation. What about conventional vaccination? Where shall we stand? To better understand the pros and cons and the confusion that they engender and that currently exists about vaccination, a brief review of the more recent history of medicine may be helpful. As philosopher George Santayana pointed out, those who don't know history are destined to repeat it. I made a brief overview of the history of medicine that prepared the ground for today's state of conventional, to understand today's state of conventional medicine, which can be viewed in my presentation of October 16th, and that's available at the website of the American Institute or the Canadian Academy of Homeopathy. I made also a review of the subject in greater detail in my 2 upcoming books. One is The Use of Medicine to Prevent Epidemic Disease, the scientific evidence of the efficacy and effectiveness of Valerian to prevent scarlet fever, a systematic review with its documentation and narrative, while the other is in The Risk and Benefit of Vaccination, an holistic perspective. Do your own thinking, but first inform yourselves. I will make, I have made with this presentation, you have it in the handout, unedited chapter of the above book on the risk and benefit of COVID vaccination, and the epilogue of the same book. The major reason why the pandemic turned into a major health and socioeconomic crisis is the helplessness and ineptitude of conventional medicine to effectively deal with people suffering from respiratory tract infection. The problem is not due to unvaccinated people, like they want to say. They should look at themselves. It's your ineptitude to deal with somebody with a respiratory tract infection, a viral respiratory tract infection. If it's bacterial, you have the antibiotic. If you have viral and it's a new virus, you don't know what to do. And nobody should be treated them. But it's ineptitude. It's ineptitude. And read the epilogue. I made a whole story about it, of how the world could have been different if John D. Rockefeller had decided to invest. He was a die-hard homeopath, and he had billions and billions, did not know what to do with it, and his secretary invested in medicine. Instead of not being involved, he should have been involved. Says, no, just invest in homeopathy. Because he didn't let any member of his family being treated with allopathy. He should not have let one of his buck being invested in allopathy then. He was not consequent. But he could have changed the course of history. He could have, he missed his appointment with destiny. So the bottom line, that's the end. We're at the end of our presentation. The experience has been uniform among many colleagues for the prevention of COVID and clinical outcome of COVID patients. The prevention of COVID-19 with prophylaxis is very effective and safe. As a rule, it is easy to treat patients with COVID-19, acute and chronic, as long as you're applying the fundamental principle of genuine homeopathy. Occasionally, a case may require more attention, and this is more common when there are comorbidity, as well as in odd cases after the arrival of the Delta variant. Yeah, with the Delta variant, some people become more sick. Beware, the picture may change during the course of treatment, especially more advanced COVID case, which is not commonly seen with other similar febrile conditions, such as influenza or acute viral or bacterial pneumonia. It is important to continue to administer the remedy even after the apparent signs of recovery and also after what looks like full recovery. Yeah, don't stop the remedy if they seem to be recovered. So wait, and I'll talk to you in 2 weeks. No, because in 2 weeks they could relapse. You keep giving them the remedy. Gupta does the same thing. If he finds out that if he keeps giving the remedy after they recover, there's no relapse. If you do that, you take a chance of relapse. Why would you do that? So here we want to, before I will take some questions from the people, the attendants. Thank you, Dr. Hahnemann. You have not lived in vain. We have saved a lot of lives during this epidemic, as your labor have prevented much morbidity and saved innumerable lives in the current pandemic. So thank you for your attention. And now I will go to Tim and see if we do have some questions. Tim?
Yes, Andre, there are a bunch of written questions.
Can you just summarize the main ones?
Okay, there's quite a few.
Or shall we take hands?
There are some hands too. Let me go through the written questions and let's see where
I'll ask. Well, I see Lee. I'll ask Lee. He has a question. Hello, Lee. You have to unmute yourself. You have to press the little microphone. Yes, you got it.
Hi, Andre. Do you have any thoughts or observations about people that had COVID early, let's say, you know, January, February, March, the first wave? If you had COVID at that time and you weren't vaccinated afterwards, your in terms of your ability to prevent or you know, fend off the variants that came afterwards. Any thoughts on that?
You may have a bit of immunity, but the like for instance, the Delta, having had an infection with the Delta does not protect you for the Omicron.
And that kind of makes sense in the sense that people that are vaccinated within the last year, that they don't seem to have much resistance to Omicron either.
I wrote this in the on the paper on the risk and benefit of COVID vaccination. which I give it to everybody. You can read it. I mentioned that the vaccine is effective for not preventing infection, but for severe disease and hospitalization between the 3rd and the 10th week. After that, they just go back like the rest of the population slowly. And after the 20th week, they're exactly the same as everybody else. And maybe worse, according to British data. However, that's not very important to say that. The point is, if you did get the Delta, or if you you will not be immune to the Omicron.
All right, thanks, Andre.
Okay.
Andre, a lot of people are asking where they can get Carbonium Ox, especially quickly, especially in the higher potencies, which pharmacies. I know we've gotten some from up to 10M from Hahnemann Pharmacy. I know you have a bunch of potencies.
Yeah, we have up to 200M. Unfortunately, it's not a remedy that is easily available. If the president of an association wants to write us, we would send them all the remedy to that president, and that president would distribute to the people in the country. That could be a way to do it. So, because it's not easily found, but there will be some, especially European pharmacy will have the higher potency. You see it like in our practice, we use the very high, like the CMs, 125, 150, 175M, 200M potency. That's the highest we have, but we'll probably start to raise it even higher than that.
I see
So,
here,
yeah.
Janik Peterson, looks European, says Helios has it.
Yep. So Helios and Remedia are likely to have it.
Susan Beal is reminding people there are 4 handouts which are available right now on the GoToWebinar site. If you look under the tab, if you go down the different tabs on your control panel, one will say handouts. There's 4 handouts, the Carbonium Ox and that. And Andre, you said that the handout, this current handout, will be available where and when? The one that you went through today?
Oh, I could make it available now because we're allowed to.
If you could you'd save yourself and all of us a lot of time and
Now I'll put it right now.
If you just put it on the website now.
Yeah, I just want to see. There's a quote here, but it says 4 of the 6. Okay, so it's 4 of the 6. I just want to correct this. 4 of the 6. It's an S. Okay, so I'll put as the handout right now. Okay, so we can continue the question while I do this.
One question from Lisette Naragon. Would you prescribe Carbonium Ox without shortness of breath, but with great lethargy?
Oh yes, absolutely. It's part of the picture. They don't need to have severe respiratory tract symptom at all. No, just the lethargy that is worse from slight exertion, the weakness, the confusion of the mind, the that all worse from the slightest exertion. Yes, it's very, very successful. And also, if you ask them to go to the window and open the window and see how they feel, and say, oh, it feels so much better. They might not know that they're like this, but if you ask them to do it and they do it and it feels so much better, it will be confirmed. It will confirm the remedy. If they're totally indifferent to the fresh air, the open window, maybe not prescribe Carbonium Oxygenator. Same thing with intoxication from carbon monoxide. When people are poisoned with carbon monoxide, as soon as they have open air, they revive. They just come back to life. It's just wonderful. In the emergency room, they would put them with concentrated oxygen, and as soon as they put concentrated oxygen, they come back to life. Yes, Tim.
Erica Holt asks, is there an issue with transfer of viral spike proteins from vaccinated to unvaccinated patients?
Yeah,
like a partner, one is vaccinated, unvaccinated.
Yeah, there's certainly something happening. There's certainly something happening because the people that are very sensitive, and the husband got vaccinated 2 times, 3 times. Every time the husband was vaccinated, the other person fell sick with the symptom of COVID. So there's certainly a transmission, yes. And there are papers showing they have found it in the in the mucous membrane of the vaccinated person, the S protein. Yeah.
And Erica is also asking for post-COVID syndrome, how are you dosing the Carbonium Ox? You said 200 C every hour for 3 doses.
No,
and then
you always individualize the pathology for each person, depending of the sensitivity, how bad they are, and their age, and so on. So you gauge it. So it would be just a general rule of homeopathy of adapting the pathology to be optimal. Optimal means finding the best potency for that person at this time, repeating the best way you could at this time, and the how to do it. So some people that are hypersensitive would do with a toothpick. Other people is a tablespoon of water. Another one is a drop of water. So you find what is optimal for each person, and the response of the patient to the remedy will tell you if the way you prescribe it, you did it well. And if it's moving slowly, that means your pathology is maybe not high enough. If the patient is aggravating, it means it's too high, or you're not prescribing properly.
Here someone's asking, they're saying it's interesting that Carbonium Ox is best for the Omicron variant and the vaccine pathology. I think they're asking, do you think that the vaccines actually led to some of the variants? I know some of the virologists, Robert Malone, Gert van der Bosch, others are saying that that's true. What is your opinion?
Yeah, if you look at the paper that I gave you, by the way, I did put this presentation of today as a handout. So you have 5 handouts. We are allowed for 5, so we fill up our trunk today. So you have all 5 handouts. And yes, in the handout that I talk about the risk and benefit of COVID vaccination, I do mention there that the question was, Tim?
It's interesting that Carbonium Ox is useful for the Omicron variant and also for the effects of vaccination. Do you think there's been an effect where the vaccine has actually promoted more of the variants? And I think several vaccinologists have already said that.
Okay, I remember now. Yes. Okay. Yeah. So yes, I mentioned in the paper that you have on the risk and benefit of vaccination that everywhere where there was a variant, and the variant came before mass vaccination, you have to remember, except for the Omicron. So the variant came like the Delta, the Alpha, the Beta, they came in the summer, fall of 2020, before mass vaccination started. Everywhere where the variant was first reported, was first found, was a place they were doing already vaccine trials. So it's everywhere the first variant came out was places of vaccine trial. Every single one. I reported them, even for variants that were not well known. I also mentioned. But since vaccination, you will have a lot of variants. You have to remember, it's normal for a virus to have many variants, even when in a single person. You may have, when you're infected, you may have billions of virus, and each of them mutates in a random basis that we think, not we think, they mutate. Let's put it this way, they just mutate, and there will be some that will be better than other ones to survive the immune system, and those survive best and will be transmitted to other people, and the other people, then they have a new variant now, and the one that will be most transmissible will be the one that will transmit more and more and more to the rest of the population. And sometimes it could be less virulent, but other times it will be more virulent. The virulence is not related to transmissibility. Sometimes yes, sometimes no. For instance, in scarlet fever, the rule was the most transmissible variant. There's about 150 different strains of streptococcal A that will be related to scarlet fever. The most virulent strain of streptococcus are the most transmissible. Interesting. The more transmissible, the more it's virulent. For the flu, not necessarily. It could be, one could be very transmissible, not so virulent. Some will be more like the Spanish flu was very transmissible, extremely transmissible, and extremely virulent. So it would vary. Same thing with COVID.
Susanna Gutierrez has asked a couple questions, and first of all, she's wondering what about homeoprophylaxis for those who've been vaccinated, and is there any data on that? And then she's also asking for experience with the COVID nosode for treating COVID or long COVID.
Well, we talked about the. Oh no, I don't know about the nozzle for treating the long COVID. I couldn't tell you. And the first part of the question was what, Tim, again?
What about using homeoprophylaxis for those who've been vaccinated?
Sure, you can. Some people are receive vaccine is the first 2 weeks of the vaccine, you're not very well protected, and after 10 weeks, you lose your protection. You start to lose protection, and by the 20th week after the vaccine, you're almost no more protected, maybe even more susceptible. But you know, the overall picture of vaccination, don't just focus on COVID vaccination, look at the overall picture of vaccination, which I did very well in the book on the risk and benefit of vaccination in general, viewed from an occultist point of view. One of the main arguments that we have in homeopathy that are not favorable for conventional vaccination is that a population that is vaccinated is a sicker population. And all the studies that have compared vaccinated versus unvaccinated population show that clearly. And then when you specifically look at certain vaccine and look at population, they do prospective study, you see damaged people right and left all the time, you know. Like for instance, like with this, I don't want to go into that, it's all in the book. And there's a better alternative. The alternative is cheaper, like more cost effective, it's more effective, it's 100% safe and easy to deploy, and simple to use for people. So there's no reason that we should encourage vaccination when we have something that is better and you don't damage people, more effective and you don't damage people. So these are the main arguments, but we have to show it to our colleagues, to the population in general, to politicians, to public health agency and so on, that homeoprophylaxis is very effective, it's safe. That's what the reason to write the book on belladonna, and that there is danger to vaccination, and that's the book on vaccination, is there is danger to vaccination, and people should be aware and make informed decision when they decide to go for vaccination. I tell you, somebody that would go for vaccination after they read the book I wrote, I don't understand their unless it's somebody that is very old, doesn't care to be to reproduce. They're too old for reproducing, like they're 90s, and they have a lot of comorbidity. Should they get vaccination? Maybe it's the better decision. I make that scenario in the book. But for a person of reproductive age, a pregnant woman, a breastfeeding woman, young people with no comorbidity, why would you get vaccinated? If you have access to homeoprophylaxis and homeopathy in general, and good quality healthcare, there's no reason, no good reason.
I know, Andre, there are at least 3 studies I'm aware of. There's actually more. There's a researcher from Africa, AABY, who's published a lot on increased mortality after vaccination. More recently, in 2021, Brian Hooker published a study of vaccinated versus unvaccinated children, showing the burden of chronic disease in the vaccinated. Paul Thomas published a similar study in 2020, and there's a Mawson study from 2010 looking at exactly the same thing. So the data is starting to accumulate. Of course, it's not shared in the conventional press at all.
Yeah, it's all in the book. It's all well documented in the book, all these studies you mentioned.
And what about treating myocarditis, post-vaccine myocarditis?
I had 2 cases post-vaccine and they respond very, very well to which remedy. One was Carbonium Oxygenator for sure, And the other one I can't remember. I had 2 cases post-vaccinal myocarditis in young people also. Well, young, 25 and maybe 30.
That kind of covers all the questions. I'm just going through to see if people have their hands up. Zareem Khan has her hand up.
Okay, so
Her hand up. I'm going to unmute. So unmute yourself, Zareem Malik Khan. You have your hand up.
you want to unmute them?
I unmuted them. They have to, I think, unmute themselves. Zareem Malik Khan, if you're still there, you can unmute yourself. I'll move down, see if there's others. You can go ahead and speak.
I'm here. Hello. Hello, doctors.
Hello.
Hi.
Hello, doctors. Have a
Yes.
great evening.
We can hear you. Ask your question.
Hello. Yes,
Ask your
actually, you're just discussing, doctors. Hello.
Yes, we can hear you. Go ahead. Ask your question.
Oh, I think
Okay.
she was saying we already discussed it.
Oh, we discussed it. Okay, I see. Okay. Okay, let's move to somebody else.
Another question, a hand up, if I can find it. Isabel Kalnagaretz. I'm going to unmute you, and you have to unmute yourself, Isabel.
Yeah, make sure that you give the information that was given today, spread it among your colleagues and your patients so the people are more aware of the possibility of homeopathy to deal with this pandemic. We don't know if Omicron will be the last one. It will be unlikely to be the last one. So we don't know what will happen in the future, but people should be aware that we have the big hand of the stick here. Not politically, but clinically. Yes, somebody has a question?
Isabel, are you there? If not, I've got Rick Esker. I'm going to unmute you, Rick, and you can unmute yourself. You're unmuted now. Rick, go ahead.
Hi there.
Hi, Rick.
Hi, Andre. Wondering, given the clinical efficacy of the carbon oxygenator, should we consider using it? I know you love the word routinely, but should we consider using it routinely, like we do Brionia for homeoprophylaxis?
Oh, yes, I've said it. For Omicron, it's the remedy we give routinely for prophylaxis, yes.
Okay.
But for homeoprophylaxis, we give the genus Epidemicus routinely. But if somebody is sick, if they're just at the beginning, you cannot recognize, yes, give it to them. If it's the right remedy, they will not call you back. Or when you call back, they'll be fine. But if it's not the right remedy, the condition will continue to progress unless they didn't use the right potency, posology. But yes, you use the remedy. I tell the patient, the instructions are there. Take it preventively. If it's too late, take it every hour for 3 doses. If it's too late, take it every 20 minutes with a higher potency and call us.
Okay, very good. Thank you.
Okay, very good, Richard.
We have a
Anything else?
question from Tassetin Aleri. Let me unmute you, Tassetin Aleri. You can unmute yourself. I've unmuted you from my end. You have to unmute from your end. Tassetin Aleri. And of course, Lee has a comment, it looks like. Lee?
Yeah.
You're on.
Oh, no, I didn't put my hand up. I must have, I don't know. No, go on to someone else.
Okay. Isabel or Tassetin? Oh, Erica Holt has a question. Erica, you can unmute yourself.
Okay, you guys can hear me?
Yes, very well.
Okay, so Dr. Steen, thank you for answering the question that I had earlier. But in addition to my question, I know that I'm not vaccinated, my husband is, and so I get sick every time we have relations. I'm trying to keep my marriage, so I need to know, should I take Carbo O? Should I make a cream? Use prophylactics? What?
I would try Carbo O just before, after he's get vaccinated.
Okay,
But
after he gets vaccinated. Okay.
It's only with relation, like sexual relation, you would have the symptom?
Yeah,
Because
like afterwards.
we know it goes in the sperm, so we know it goes to the sperm, this S protein. But is it after the just a relation that you have symptom, or just being with him in the same room?
No, just after the relations, like a day or so later, I feel like, my health will be fine and I'll feel a decline.
Yeah. Patient have reported that, so you could take the remedy preventatively. Correct.
Okay, so just make sure to take the Carbo O before and after and so on.
Yeah, or what you could, the symptom, they're always the same, right?
Yes.
Look at your symptoms, see which remedy is the best. That would be the best, the best way to proceed. Try to find out which remedy correspond, but it could be Carbonium Oxygenator. It could be the first choice if you're not sure.
Okay, thank you.
Because we had other patients similar to you that had this similar experience, and yes, Carbonium Oxygenator is a remedy for that.
Okay, so it would be like futile to make like a cream or something using that, or
no, taking the remedy
no.
dynamically will make you different dynamically. When you take the remedy, it changes you, protects you on a dynamic level.
Oh, gotcha. Well, thank you for taking time.
You're welcome, Erica.
And I think, Andre, this will maybe be the last one. Danielle Straw. Danielle. Go ahead, we hear you.
Hi, yeah, so I have a post-COVID patient who has complaints of POTS, and I'm wondering if you have seen any use for Carbox in these type of cases.
There's a colleague of mine asked me the same question. I said, I don't have the experience. I just asked me the same question as you did. So I couldn't, I said, I don't have the experience. I don't know. So if you have the experience, you could report to me.
Okay, thanks. I'm seeing her tomorrow, so I'll let you know. Thank you.
Listen, it's compatible with the remedy. Like you get up and you faint. It's all very compatible with the remedy, so it could be the remedy. If you look at the proving of Carbonium Oxygenatum and the monograph that you have now in the handouts, if you look at the monograph for like postural orthostatic
Tachycardia syndrome.
yeah, if you look at that, you'll have all the symptoms there. So it's likely to be, but you'll have to see. One of the things you want to see is the patient better in fresh air? If the patient is better in fresh air, then it could confirm the Carbonium Oxygenatum. But
Okay.
it's certainly not the only remedy that would have that.
Sure. Okay, thanks so much. It's a great clue.
Okay, very good.
Andre, it looks like there's one more hand up if you want to take one more question.
Yep. Yeah,
It's by Teresa Lane McDonald. So Teresa McDonald.
Yes.
You're unmuted. On my end, you need to unmute on your end. Teresa.
Yeah, I'm curious if you noticed any remedies in particular when there's been neurological symptoms post-COVID?
Again, carbonium is highly indicated. Look at the intoxication. Carbon monoxide destroys the brain, affects all the faculty of the brain. It changes all the emotion. People become bipolar. People get very depressed. They lost complete will. People that die of carbon monoxide poisoning, they have a part of their brain, the part of the brain for will, to have will, is destroyed in the brain. The pallidum is destroyed. There's certain location that it particularly affect. People will have all kind of neurological symptoms. Read the monograph. You'll see all the symptoms. But again, you have to have the characteristic of the symptom: better, fresh air, worse from slight exertion, confusion, and so on. So there will be many remedy. It's always, you want to take the picture and say what it's similar to what remedy.
Yeah, of course.
There'll be a number of remedy indicated, but certainly because of the similarity of the S protein intoxication symptom and the carbon monoxide, intoxication symptom, it's almost a perfect match. It would be a remedy of choice here.
And then once the client is so-called recovered from it, how long do you keep repeating the remedy?
You keep repeating the remedy as long as the patient is improving. When they stop improving, you go up the potency and you see if they're improving further. And you keep doing this until they stop improving when you raise the potency.
Thank you so much.
Yeah. And maybe I should say also, if people have unusual experience, observation, something is interesting that could benefit the rest of the community, send it to me, send it to the Canadian Academy, the CAH@homeopathy.ca. Send your interesting case, and so we could maybe use it for future knowledge, or just make people being aware of interesting phenomena, like somebody that had let's say blindness, and then you from COVID, and then they recover with a remedy, or they have 3 cases of something and they recover. It would be interesting for the rest of the community to know that. So you could send it to me, and as well as to your other colleagues.
Thank you so much.
You're welcome.
Yeah,
get all the information that I sent you today. Distribute it among your friends and colleagues and so on, so people are aware of what we can do, and yeah, the power of our medicine.
So just to remind everyone, the 5 handouts, including the lecture, the monograph that Andre talked through, are available now in the handout section. Once we go offline, they won't be available anymore. So you can download them very easily. Just go to handouts. There's 5 there. Just download them right now. There's another Andre, Kay Barkley. I will unmute Kay Barkley. Kay, you have to unmute yourself.
No, sorry, I think that was a mistake. Thank you. I've missed part of the lecture and I had to come back in really late. So thank you very much for today. I do apologise.
And all the other comments, Andre, were basically, a lot of people were just saying thank you, and I'd also like to thank you for this excellent webinar.
Well, I have to thank you, Tim, again for supporting me. Without you, I couldn't do. I couldn't have. Yeah, you're my right hand to conduct those webinars. I couldn't do all the question and reading the question at the same time as it's happening. Okay, so very good. So I think the word is out. You have the information. Use it, and report if you have unusual, interesting observation. And we don't know if there will be another webinar on COVID. Oh, I want to remind people though, on March 18, I will have a webinar on, I will be with the energy researcher, healer, the healing energy researcher, Bill Bengston. We will have a session together to explore his world with the world of homeopathy, try to find out what are the limits of each world and how we could combine them better, and it should be very, very interesting. So put that on your calendar. I think at 10:30 on Friday.